Well, good afternoon, and again, thank you all for joining us for another announcement. Since we met yesterday, it has become clear to everyone that states all over the country need to take a greater leadership role in response to the COVID-19 outbreak. The situation is fluid, and it is changing rapidly. Virginians should know that we have long-standing plans in place to deal with pandemics. We have trained for them, and we are ready for this. Today, we're taking 4 actions. First, I am declaring a state of emergency in our Commonwealth. This declaration implements our long-standing emergency operations plan. This plan will be led by the Virginia Health Commissioner, Dr. Norm Oliver. While Virginia has been thoroughly preparing for weeks and has adequate funding to address the situation, this declaration will give us increased flexibility to ease regulatory requirements and procurement rules, continue federal and multi-state coordination, and ensuring ongoing support for the most vulnerable Virginians. Second, I am canceling all specially scheduled state conferences and large events for the next 30 days. That includes a Women in Innovation Conference scheduled for next Tuesday. I know that much planning, work, and time goes into these events, but I believe that this is the safest course of action at this time. I am encouraging localities and private organizers to similarly limit large events based on consultation with their local health departments. I advise Virginians to avoid large gatherings for the time being. I am also prohibiting out-of-state work travel by state employees for 30 days. We are directing state agency heads to make reasonable accommodations in regions like Northern Virginia and border communities like Bristol where that is not practical. We will assess these directives going forward. We anticipate that this break will allow time for more testing kits to become available. And let's talk about testing kits for just a moment. So far, as of this afternoon, 15 people in Virginia have tested positive. All of them have been traceable to a specific source. We are also aware of 2 Virginians who are currently in Texas and tested positive there. And we are working with Texas to determine the best course of action for them. I want to be clear. Right now, we believe we have enough testing kits in Virginia, and we believe more will become available. It is clear, however, that the CDC supply chain is in fact limited. So here's what we are doing. We are looking at developing our own test kits. There are also private labs in Virginia authorized to run these tests. While the state is not involved in that work, we understand the private labs are upgrading their capabilities to do more testing. We are watching the experiences of other states, including the use of drive-through testing, and we're considering that option as well in our Commonwealth. Ultimately, all of these steps will depend on public health needs supported by science. Third, for the state employee workforce, we are taking actions to phase in telework and other remote working options as appropriate. For official public meetings, we are working with Attorney General Mark Herring to issue guidelines that allow public business to continue in full transparency while acknowledging the seriousness of the public health threat. And for public schools, as Dr. James Lane, our Superintendent of Public Instruction, said yesterday, we continue to urge that public schools make their own decisions in consultation with local public health officials. Those decisions will be tailored to local needs, taking into account the differences between our densely populated and our rural areas. There are some factors we know our school divisions will take into consideration. For example, Schools build days into their calendar for snow days. But in most parts of the state, we have had a light winter, and those days should be available. Schools need to consider how best to serve their students with disabilities and make sure there are accommodations. And while rates of absenteeism are typically factored into our accreditation process, this emergency order will give authority to issue waivers for that requirement. I know students may have plans to leave the country for spring break, and schools are considering their risk level when they return. We know the private sector is also taking many similar steps. We know that their actions and ours will have economic consequences. The fourth action today is that I am directing our top economic officials to continue to assess how this will affect our economy and what we can do to mitigate that. Our goal is to get everyone back to work as quickly as possible. But make no mistake, protecting public health is our top priority. That is driving all of these decisions, and it will be the determining factor of all our decisions as this situation moves forward. Now, before I turn to your questions, let's talk for a moment about what you across Virginia can do. Many people are asking, what do I do if I think I have symptoms? The first thing to do is to call your provider. Doctors can order tests, and they will do so based on medical necessity. Primary care doctors can perform the swab, that is the initial part of the test. Our health department has communicated with our doctors and health providers about the steps to take after that. As you heard from the folks from the Medical Society of Virginia and the Hospital Association yesterday, our health providers and facilities are regularly providing guidance to their members. But remember, there are things you can do to protect yourself and others. If you are part of a high-risk population, that is, if you are older or have an underlying health condition, you should be especially cautious. Avoid large crowds and avoid traveling if possible, especially on airplanes. And for everyone, you have heard me say this before, wash your hands with soap and water, cover your mouth and nose when you sneeze, stay home if you feel sick, and avoid touching your face. We understand how critical it is to stay in front of this disease. While it is very likely to spread, our actions can help mitigate how fast and how far this virus spreads. It is our responsibility, every one of us, to take this seriously and to do our part to help limit the spread of this disease. I appreciate the legislators joining us. I know you all have had a busy day. I would remind all of you, this is a nonpartisan issue. We are all on board to make sure that we keep you, Virginians, safe. We also are all on board to make sure that we give you the most up-to-date and accurate information as it becomes available to us. I thank you all for being here again today, and I would be glad to address your questions.